It is the popular saying that an healthy society is a wealthy one. On the Great Mind program, medical experts are available to provide solutions to various health challenges. You desire greatness in life. Successful men and women in the society are available on the Great Mind program to reveal to you the secrets to their greatness. The Great Mind of Nancy Osun is a watch for all. Meet me on the program every Sunday between 3:30 and 4 p.m.
Happy Sunday to you, all our viewers at home. It is another educative moment with me, Bola Olayode, on the program, The Great Mind. Very soon, all the pregnant women in Osun State will be enrolled into Osun Health Insurance Scheme for free medical care. The disclosure was made by the Executive Secretary of Osun Health Insurance Agency, Dr. Rasak Akindele. Commitment of an individual to the achievements of one's set goals in life, crowned with the encouragement from God, is what defines how far one will go in life and impact positively on the lives of others. This principle also applies to organization. Osun Insurance Agency is an organization that is committed to the objectives of its establishment with the unflinching support from the Governor of Osun State, Senator Ademola Jackson Adeleke, who is very passionate about the well-being of the people entrusted unto his care by the Supreme Being to govern. It will be recalled that on the establishment of Osun Insurance Agency through an enactment, the agency has among its objectives ensuring that every resident of the state has easy access to effective, quality, and affordable healthcare services, protecting families from financial hardship of huge medical bills, containing the cost of healthcare services to attain efficiency, ensuring equitable distribution of health costs across different income groups, and also maintaining high standards of healthcare delivery services within the health sector. Commitment of the leadership and members of staff of Osun Insurance Agency to the full realization of the set goals of the agency is what informs the quarterly meeting and training of the healthcare providers accredited by the agency at ensuring their optimal performance to the great benefits of the enrollees under Osun Health Insurance Scheme. Few days ago, Osun Health Insurance Agency organized 2 days training for the accredited healthcare providers across the local government areas of the state. The second day of the training of the healthcare providers on basic emergency care was dedicated to interaction between the leadership of Osun Health Insurance Agency and the healthcare providers, where the Executive Secretary of Osun Health Insurance Agency, Dr. Rasak Akindele, enumerated the achievements being made by the agency through the support of Governor Ademola Adeleke, who is very passionate about the well-being of the people of the state.
Was started by the previous administration that were able to complete, furnish, and commission the new social complex. I also told you that we have almost completely digitalized our system at Osun. The agency also have full board in operation and is one of the few agencies in government that have complete board. I inherited, yes, 180 people of Fela to work. They won't collect money from you for clapping. And I will tell you that within the time that we have had 5 successful board meetings. We've also been able to inaugurate the Ethics and Research Committee for Osun. So any of you that will be undergoing studies, especially that has to do with our health or any public health issues, can get your ethical clearance from Osun. And we can also collaborate with you to do these studies. This committee can to look into our data. We have a very, very large data bank. And they are also to look into this data and bring us to it. I will tell you that we have had 4 articles published in renowned journals since the inception of this ethical committee. We have been providing drugs. We know that sometimes you may run out of drugs and you need this to operate. If you come to us, we will supply the drugs and deduct the money from your applications. We can even spare it to make it convenient for you. We have been doing that. But just recently, when the DNA, the Drug Management Agency for the state was inaugurated, we will transfer this service to the DNA. We have had an agreement with them. But you still have to come to us, let us know what drugs you need, then the DNA will supply you, who will make the payments to the DNA and spread it for you to make it convenient for you. Now the DNA is going to operate in a way that the drug supply is not going to be higher, the price is not going to be higher than anywhere in the state or outside the state. So we should take advantage of this. We have also assisted the government in distributing multi-million naira equipment to facilities, mostly government-owned facilities. It will be difficult to do that free of charge to private facilities. But what we have told you, though nobody has come on board to tell us, we have had agreements with some financial institutions. And we told you during the last providers forum that if there are things you need in your hospital that you think will make your hospital function very well, centrifuge, incubators, suction machine, things like that you think you need that will make your facility, you can approach us. We will get the financial institutions to finance them, supply to you, and spread the payments. And the supply, the cost, will not be higher than what you will get anywhere in the country. So it's not a profit-making thing. It's to cushion the effect. And for us to have good practice on all our various facilities. We have also embarked on several training and retraining of our staff to make them poised for effective functioning. And by extension, that is what we're doing for our facilities. And that was why we organized the training section yesterday. Also, you will note that last year, His Excellency, Senator Dr. Jackson approved that we should enroll all pensioners into holds. And you know this age, when they are retired, that is when you have a lot of non-communicable diseases common. Hypertension, diabetes, arthritis, cancers, and things like that. And the legal amount they are collecting from government, we don't want them to spend it on government. So we brought on board 23,000 pensioners. That's still counting. Because every day people retire, and as they retire, they come to start with us. Immediately we did that, we had collaboration with Rotary International, and we had free health, free medical and surgical outreach for these pensioners, and we were able to attend to about 7,000 of them during that outreach. Also, the governor approved the enrollment of people with disability into the scheme. We had registered close to 10,000 of these people with disability, free of charge into the scheme. And not only that, we asked them for what would make life more comfortable for them during the registration. And they gave us the equipment or materials that they would need, ranging from wheelchair, walking stick, crutches, hearing aids, ultraviolet umbrellas, cream. Those were particularly for their business. You know, people with disabilities are identified tools. The physically challenged, those ones you can see, the limbs, deaf and dumb. Those who are blind, the spinal cord patients, and their bills, and they have different requirements. Statistics show that most deaths on their bills were caused by skin cancer. So if you're going to help them, you have to take measures that will prevent skin cancer. So that was why we imported a lot of ultraviolet cream, ultraviolet glasses, ultraviolet umbrella. When they use it, it prevents them from having direct infrared effects on their skin. And they were given free. Even some of those spinal cord patients that needed motorized wheelchair, we give them, and that's in millions. And we teach them, we taught them how to operate. And after that, we discovered that eye problem is one area that we don't pay a lot of attention to. In fact, I use myself as an example. That if I had eye problem when I was in primary or secondary school, maybe I would never become a doctor. Because I belong to those people you call backbenchers. And we talk about that's all we do. That's a very bad I like teachers. Now, if I had refractive error or any eye challenge that side, I will not be able to see what the teacher is writing on the blackboard. And that is happening to lots of students. They stay there, they do not see what the teacher is writing on the blackboard, and that translates to poor academic performance. And you just look at it that they are constantly failing. So we requested that we screen all public primary and secondary school students. And it was quite alarming. We had the statistics of about 350,000 students that we have. And we engaged their screening. Now, if you look at studies that have been done all over the world on public health and school high health, yes, if you have this number, you're going to have about 20,000 of them that will have high burden, whether refractive error or infective or cancer or congenital problem. It was alarming that we had about 45,000 in Osun State, out of the 350 that was screened. So initially we imported 20,000 glasses, but eventually we have to import more to cater for the 42,000 people that had refractive error. In fact, the next exercise is to screen the teachers. Because we found out that even on the teacher But the first happens to train the teachers who help us in this training before we do the final reflection for them. And we find out that about 5% of the teachers too are going and we provided for them. There were some, in fact, we had 4 critical cases that are almost near blindness. One was a congenital absence of the vitreous humor. One was almost complete retinal detachment. It has been going on gradually, and it's almost complete now. We have 2 cases of congenital glaucoma. We have scheduled all these 4 people for surgery, and that is going to be done free of charge too. That will lead me to the next program we have. That is going to involve all of us present here and not present here. But I'm going to particularly note those of us that are here. Because you are hearing it here, it's not hearsay. We tag that in Mole Davis. I attended the sector-wise appraisal of the southwestern states, using some indices, health indices, maternal mortality, newborn mortality, neonatal mortality, and infant mortality, and I was particularly unhappy with our statistics in Osun State. That's you. This is our state. In those days when Lautech had crisis, and Akala ordered all of us to move to Ogbomoso, some of us stayed back, and we were expecting the worst. The worst is that it will sack us and ask us to go. But that hospital, today we should be university of it is our legacy. It is our own legacy. So we stepped back and said, that is our legacy. All our facilities in Osun State, private, public, they are our legacies. And these are things that will translate into better statistics, good living for us. I was the House Officer representative when we went to meet the governor that was then. Let me mention the name. And we told him there are not health facilities personnel, enough health personnel in Osun. And he said, what can he do? He said, give us full allowance. In those days, Osun was getting 50% of probation allowance. Whether more duty, whether shift duty, whether any duty allowance. Said, give us full allowance. And he not only approved 100% allowance, he made it up to 120%. And what was the effect? Influx of medical personnel into Osun State. The next thing he did was to give us tax rebate on professional allowances. And that made it very attractive for us.
As revealed by the Executive Secretary of Osun Health Insurance Agency, among the plans of Governor Ademola Adeleke's led administration for the people of Osun State is the enrollment of the pregnant women into Osun Health Insurance Scheme for free medical care.
Let us reorientate ourselves and say the calling of our profession is that we get fulfilled when we get patients cured or treated of the illness. It is not when we get money from the patient. So the money babies is targeted at all pregnant women. We want to improve the outlook. So we want to bring on board all pregnant women, register them free for their antenatal care and delivery.
The interactive session went thus on the second day of the training of the accredited healthcare providers on basic emergency care.
Doctors know what they are doing. They are practicing ethical consideration. Professionalism means it doesn't make you to be inferior, but makes you to be a better doctor.
Things are better now. On behalf of the prayer, I want to say well done and thank you to the management.
To appreciate the Osun and the team, the executive secretary and the team. And I also particularly want to celebrate you for the outstanding achievement within a short time. That's very commendable.
Enrollee Providers Forum. Enrollee Providers Forum. Well, as an advice, I think that's going to solve, or go a longer way to solve that problem. I think what we did then was to bring samples of enrollees from ministry, agency, parastatals, bring them together in a meeting like this with providers, and let us brainstorm to ask the enrollees what are their challenges.
I give you kudos to the way you are working, and we are seeing the feedback in our units. Most of the questions I want to ask have been answered, but I want to put only one: the attitude of patients.
And also the service time, professional service time. We have seen a whole lot of things, a whole lot of complaints, a whole lot of questioning. The patients always coming, wanting to do anything, and then calls proposed to us, and she malaria will provide, and she typhoid will provide, and all sorts of things. A lot of questions, some investigations, many of the report, she will provide. And at that point, at the moment I was that imperfect, it took the heroin and the doctor. If questions are answered, honestly, there will be need for us to get some of these things at the back end. So, and it boils down to the fact that they are still not familiar enough with our operational guidelines and also the benefit package. Of course, the guideline that we have inside it, we have the benefit package. Of course, it has been reviewed, and the source code of guide review has been sent to the platform over time. So please, I want to beg, I want to adjust. We should not at this point, it's 4 or 5 years down the line. We should not be talking about show and provide. I am begging you, let us please be familiar with our benefit package. So that at that point, and then if we need this for cover, honestly, it's at that point that tell the patient or the enrollee, I'm sorry, this is not covered, and they don't go back and forth asking the agency, what can we do? A lot of times, they come back to the agency and share the shit, they put some compassion, let us try to do what we can, and all sorts. And from there, the length period of time to go, and then the complaints from the enrollee went out alarm, and then all sorts of questions. Then at that point, once we know, let us terminate that conversation at that end. So that once you terminate it, they go accident, and there won't be need for any recourse to come back to the agency. I think that the 10% co-insurance, please, it is important for the formal sector and the informal sector. Of course, the people with disability and also the pensioners, they are excluded. Because the government has given the direction that should not be accepted from them. But for the formal sector, it is your money and you need to collect it from them. But we are paying 10%, it is 10% on drugs, not 10% on service.
Accredited healthcare providers or Fortune Insurance Agency, F, this to say at the end of the 2 days training on basic emergency care.
We are told on how to handle emergencies, especially when people collapse, other marketplace, whatever it is. We are trained on how to handle all these issues. And now when people collapse, so many people are due to reasons to either somebody is they are being followed or it's an evil something, but we know that it could be as a result of cardiac issue. So when this happens, we know we are trained on how to resuscitate.
Collaborative effort. I've seen all the different parts of the agencies doing the best they can. So it's really a very welcome development, very encouraging. Thanks to the government, thanks to the police, and also thanks for the healthcare providers themselves and all the HMOs. This is really going to take the health sector of the country to the next level.
Ẹ bá mi ká lọ sábàlá ètò yìí lédè àbínibí wa. Ìfiyèsí ìlànà tẹ́nìyàn ń là sílẹ̀ láti làlùyọ nínú iṣẹ́ tẹ́nìyàn bá yàn láàyò pẹ̀lú àtìlẹ́yìn Olódùmarè ọba aṣẹ̀dá ló máa ń ṣàtọ́nà sí àṣeyọrí ẹ̀dá lórí ilẹ̀ alààyè. Bó ti jẹ́ pé ó ń ṣẹlẹ̀ sí olórí jorí, bẹ́ẹ̀ náà ni ó jẹ́ pé ìlànà yìí kan náà ló máa ń ṣàtọ́kùn fún àṣeyọrí ilé iṣẹ́. Àjọ elétò ìlera ìpínlẹ̀ Ọ̀ṣun ló jẹ́ ilé iṣẹ́ tó fi gbogbo ìgbà tẹ̀lé ìlànà àlàkalẹ̀ rẹ̀ láti ní àṣeyọrí tó tayọ pẹ̀lú àtìlẹ́yìn gbọ̀ngbọ̀n tí gómìnà Adémọ́lá Jackson Adeleke ń ṣe fún ilé iṣẹ́ náà, látàrí bó ti ṣe jẹ́ pé gómìnà Adémọ́lá Adeleke jẹ́ ẹni tó nífẹ̀ẹ́ tó gbópọn sí àwọn ènìyàn tó Olódùmarè fi ṣe alákòóso lé lórí. Òfin tó ṣàgbékalẹ̀ àjọ elétò ìlera ìpínlẹ̀ Ọ̀ṣun ló gbé iṣẹ́ lé àjọ náà lọ́wọ́ láti dájú pé gbogbo ènìyàn ìpínlẹ̀ Ọ̀ṣun ló ní àǹfààní sí ètò ìlera tó péye pẹ̀lú owó bíntín láti lè dóòlà àwọn ìdílé kúrò nínú à ń fọ̀rọ̀ ẹni ṣòfò. Ìfijìn àwọn adarí àti àwọn òṣìṣẹ́ nílé iṣẹ́ àjọ elétò ìlera ìpínlẹ̀ Ọ̀ṣun sí ìlànà à ń tẹ̀lé fún àjọ náà ló ṣokùnfà ìjíròrò pẹ̀lú ìdánilẹ́kọ̀ọ́ tájọ elétò ìlera ìpínlẹ̀ Ọ̀ṣun máa ń ṣe lóòrèkóòrè pẹ̀lú àwọn òṣìṣẹ́ ilé ìwòsàn tájọ náà kò ń tẹ̀lù láti máa tọ́jú àwọn olùkópa nínú ètò ìdójútòfò ìlera. Akọ̀wé àgbà fún àjọ elétò ìlera ìpínlẹ̀ Ọ̀ṣun Dókítà Rasaki Akíntúndé Akíndélé ṣàlàyé àwọn àṣeyọrí onírúurú tí ìjọba tí gómìnà Adémọ́lá Jackson Adeleke ti ṣe lórí ètò ìlera, ó sì tún fi léde àwọn èròǹgbà rere oríṣiríṣi tí gómìnà tún ní fún àwọn olùgbé ìpínlẹ̀ Ọ̀ṣun.
Kọ̀ọ̀kan la ti ṣe síwájú àti gómìnà ti ní pé wọ́n ti fọwọ́ sí pé ká mú gbogbo àwọn òṣìṣẹ́ fẹ̀yìntì pátápátá ká fi wọ́n sínú ètò àdójútòfò ìlera yìí kí wọ́n lè máa gba ìwòsàn ọ̀fẹ́. Gbogbo ẹ̀ láti ṣe àti bí èèyàn 25,000 àwọn pensioners náà ti wà on board náà tàbí fún wọn síbẹ̀. Gómìnà tí ní fi wá àwọn àkàndá pátápátá ara wa ni wọ́n ká fi wọ́n sínú ètò àtìkọ̀nà náà síbẹ̀. About 10,000 àkàndá láti wà lórí ètò yìí. A ti fi tàwọn ọmọléèwé tí a fún ní àwọ̀ ojú about 45,000 àwọn kan wà tá a fẹ́ ṣiṣẹ́ abẹ fún wọn gẹ́gẹ́ bí gómìnà ti pa wá láti ní ká ṣe gbogbo wọn náà ló wà ń bẹ̀. Eléyìí tó ń bọ̀ lọ́nà náà ni pé gbogbo aboyún tó wà pátápátá àfẹ́ fún wọn ní gbogbo ìgbà tán wà nínú oyún kí wọ́n tọ́jú wọn ní ọ̀fẹ́ àti ìgbà tán wà nínú oyún àti ìgbà tí wọ́n máa bímọ àti mílíọ̀nù tán bá bímọ tán tí a bá ti gba gbogbo àṣẹ tó yẹ kó gbà lórí yẹn á gbé gbogbo yín jọ náà tá a sọ fún yín bí ètò yẹn ó ṣe lọ lẹ́sẹ̀lẹ́sẹ̀.
Tí gbogbo ìgbé àwùjọ bá wà ní àlàáfíà pípé, ìdàgbàsókè tí kò lẹ́gbẹ́ ló máa mú wá fún àwùjọ náà. Ǹjẹ́ ibi tí a ó máa fi àdàgbé ètò rọ̀ sí nìyí lónìí, ẹ jẹ́ kí a sì jọ pàdé fákọ̀tun ètò yìí kan náà lọ́sẹ̀ tó ń bọ̀ láṣẹ Olódùmarè ọba àṣẹ̀dá. Ǹjẹ́ tí ìgbà náà, ire o.